All right, let's get right into it. If you're managing type 2 diabetes, I'm sure you've heard all the buzz about millets. I mean, they're being talked about everywhere as this miracle food for blood sugar. But you have to wonder, is it really that simple?
And that's really the million-dollar question, isn't it? Can you just swap your rice for millets and expect everything to get better? Well, the real answer might actually surprise you.
So here's the deal. Yes, they absolutely can be a superfood. But, and this is a really big but, they are not plug and play. You can't just treat them like a simple substitute for rice without understanding how they work. Because if you do that, you could be setting yourself up for a whole new bunch of health problems. And that's exactly what we're going to break down today. Think of this as your official safety manual for millets.
Now, first things first, let's be clear about why there's so much excitement. The benefits are totally real, and honestly, they go way beyond just managing blood sugar.
I mean, when you stack them up against refined grains like white rice, millets are just nutritional powerhouses. They have a lower glycemic index, so they release sugar into your bloodstream much slower. Studies have shown they can bring down your HbA1c, that's your long-term sugar average. On top of that, they are loaded with fiber and these amazing plant compounds called polyphenols, and they might even help with cholesterol and blood pressure. It's a pretty impressive resume, right?
But, and here it comes, to get all of those incredible benefits safely, we have got to talk about the critical catch. And that catch has a name. Antinutrients.
Okay, now hold on, don't let that name freak you out. Antinutrients are just these natural compounds that plants create to protect themselves. So think of them less like a poison and more like a lock. If you don't have the right key, these locks can stop your body from absorbing essential minerals and can even mess with really important things, like your thyroid function.
So let's get you the keys to that lock. We're going to run through a simple 4-point safety check. Think of it as your pre-flight checklist before you make millets a big part of your life.
First up on the list, your thyroid. You see, some millets have compounds called goitrogens. What these can do is interfere with a key enzyme, TPO, that your body needs to make thyroid hormones. And this risk is way higher for anyone who might already be a little low on iodine.
And look, the difference between millets here is night and day. If you have any thyroid issues at all, or if your TSH level is over 4.5, you've got to be really careful with Kodo and Foxtail millets. As you can see, barnyard millet is by far your safest bet from a thyroid point of view. Okay, checkpoint number 2. This is all about your kidney health. Certain millets are packed with something called soluble oxalates. Now, when these get into your urinary tract, they can grab onto calcium and form these tiny, really painful crystals, which then become calcium oxalate stones. And that's the most common kind of kidney stone there is. So here is the most important number you need to remember. If you've ever had kidney stones before, the clinical advice is super strict. You have to limit your daily intake of those high oxalate millets. We're talking specifically about little and foxtail millet to just 50 grams of dry weight a day. That's a very specific number, and it's a really important one. Moving on to checkpoint 3, and this one really applies to everyone. Millets have something called phytic acid. You can pretty much think of it as a mineral magnet. When it's in your gut, it literally latches onto essential minerals and holds on so tightly that your body just can't absorb them. And over a long period, that can actually lead to some serious deficiencies.
And we're not talking about minor stuff here. Look at the minerals at risk. We're talking about zinc, which is so important for your immune system, iron, which is vital for your energy levels, and calcium, of course, for your bones. If you're not careful, a long-term diet of improperly prepared millets could slowly be draining your body of these crucial nutrients.
And finally, checkpoint 4 is a super practical one: digestive issues. Millets are incredibly high in insoluble fiber. So if you go from eating white rice one day to a big bowl of millet the next, your gut is in for a serious shock. And that can lead to some pretty uncomfortable bloating, gas, and what some people call that millet-heavy feeling.
This is especially important for certain people. If you have a condition like gastroparesis, which is pretty common in long-standing diabetes, or IBS, that sudden jump in fiber can be a really big problem. For sure, the key for absolutely everyone, but especially for these groups, is to take it slow. A gradual transition is everything.
Okay, so we've laid out all the risks. Now for the good news. You can get rid of almost all of them with just a few simple traditional tricks. So let's get into what we're calling the Smart Millet Protocol. This is your action plan.
This right here is your core strategy. It's non-negotiable. First, you have to soak your millets for at least 6 to 8 hours and then throw that water away. Just doing that one thing can slash the phytic acid by up to 80%. Second, rinse them really well.
And third, you can try traditional preparations like fermenting it into a porridge called ambali, or just make sure you cook them really, really well. These ancient methods are your best defense.
And it gets even smarter. You can actually fight these anti-nutrients with the other foods you eat. Worried about those goitrogens affecting your thyroid? Make sure you're using iodized salt, and maybe add some selenium-rich foods like eggs. To help counter the oxalates, pair your millet with something rich in calcium, like curd or yogurt. And to help your body absorb iron that phytates are trying to block, just add a source of vitamin C, like a simple squeeze of lemon. It's that easy.
And one last crucial tip, don't eat the same kind of millet every single day. The research strongly recommends a 7-day rotation. By switching up the type of millet you're eating, barnyard one day, foxtail the next, you stop any one type of anti-nutrient from building up in your system, and you get a much wider range of benefits. I think this quote from the source material just sums it all up perfectly. Millets are powerful tools. They're not just food. They can be therapeutic. But their safety and how well they work is completely dependent on using them the right way, with the right preparation and making sure it's personalized for your own health.
So, you came here asking if millets are a superfood, and the answer is yes, but only if you are a super user. You now have the safety manual, so the only question left is, are you ready to use this powerful tool the right way?